This is a visual of the female uterus, being constantly stretched to its limits by a fetus. Normal internal organs are compressed and severely deformed. Even the rectus abdominis is forcefully torn apart. Looking at this before and after organ comparison chart, just the sight of it induces immense pain. As the fetus grows slightly larger, the uterus begins to take up space in the abdominal cavity. The once smooth intestines are squeezed into twists and turns, and peristalsis slows down. When stool stays in the intestines for too long, its moisture is repeatedly absorbed, making it as hard as pebbles. You could squat in the toilet for ages with no results. That unbearable feeling of bloating is simply incomprehensible to those who haven't experienced it. Making it to the third trimester, the torment gets even scarier. As the uterus expands, it gradually pushes against the diaphragm. The chest cavity is compressed like a deflated balloon. Walking just a few steps makes you pant like you've run 800 meters. And even speaking a full sentence leaves you breathless. Moreover, blood volume increases by 40% during pregnancy, demanding oxygen throughout the body at all times. But the squeezed lungs simply cannot expand. Lying flat at night feels like having a brick on your chest, forcing you to sleep half sitting up all night. Tossing and turning? The next day your dark circles are heavier than a panda's. Furthermore, bladder issues become even more embarrassing. Originally able to hold 500 milliliters of urine, it's compressed to a mere 200 milliliter capacity. A single sip of water makes you want to pee. In the third trimester, you're basically running to the bathroom every hour during the day. At night, you wake up 3 or 4 times from the urge, making good sleep impossible. What's even more awkward is that pregnancy hormones loosen the pelvic ligaments. Coughing, sneezing, or even just laughing can cause urine leakage. In public, you can only cover your face and hold it in. No one truly understands that level of distress. After 35 weeks, the baby's body is fully developed. The belly gets heavier and heavier, shifting the body's center of gravity forward. Every day, you have to thrust your belly out and arch your back. Over time, the spine and pelvis ache severely. After sitting too long, you have to hold on to something just to slowly stand. Walking looks like a clumsy penguin, and at night, your legs swell so much they can't even bend. Relief only comes after your family massages them for ages. The most heartbreaking part is the stretch marks. Rapid belly growth tears the skin's elastic fibers. At first, they are reddish-purple streaks that are actually painful to the touch. Later, they fade to white and never truly disappear, becoming permanent marks carved into the belly. Many mothers, after giving birth, are even afraid to look at their own stomachs. But every single one of these lines represents the hardship of nurturing life, proving that we must treat them a little better for the rest of our lives.